Assalamu alaikum. Dr. Arshad Mahmood here. In this video, we will briefly discuss how we are going to describe the CT scan in exam setting in a brief and a good way, so that we can cover all the points that are must to be covered. I will not go into details of individual cases that will lengthen the video. They are available in the spot diagnosis series files, so you can check them there. I will just cover the points that you should know while interpreting a CT scan in exam or ward setting. So first thing is that in discussing a CT brain, most of doctor gets confused when they get an image that whether it is a CT brain or MRI brain. For that, you have to look clearly that the bone. If the bone is properly visualized, then it is CT brain. If it is not visualized, only there is soft tissue density is appearing on surrounding area of the head, then it is MRI brain. So from this point, you can differentiate. If the bone is good visualized, then it is CT scan. If it is not visualized, only the soft tissue shadow is seen, then it is MRI brain. First thing. Second is in interpreting a CT brain. The first you will say that it is CT brain image. Second is that you will interpret whether the contrast is been given or not. Our patient is having two sequences, one without contrast or second with contrast. In contrast image, the sinuses will appear brighter, while in without contrast, the sinuses will not appear, as shown here. Then is the next is the that you will see that which view is given. There are three important views that can be given, like coronal view, axial view, and sagittal view. So you will say that it is CT brain with or without contrast, coronal view, your axial view, or the sagittal view. Any view can be there. Next is the extent of the imaging. The imaging can be a single slice, like at the level of lateral ventricle, or image can be of multiple slices starting from the vertex to the base of skull, or can be only base of skull. So as the images shows, you will describe accordingly. Like it is CT brain without contrast, axial view with multiple slices showing from vertex to base of skull. Okay. And the next is after describing the view, you will look on the brain parenchyma, so that any pathology is seen in it or not. So in CT scan, if a lesion is appearing whiter, we call it as a hyperdense. If it appears black, we call it as a hypodense. The example of hyperdense lesions are like calcification or bleed, and also bone appears hyperdense or white on the CT scan. While black or hypodense appearance things are like bleed, not bleed, like infarct, like CSF, like any cystic cavity. They will appear as a darker or hypodense lesions. Next is that you will, after commenting on all this, you will look for the midline shift, that whether midline shift is present or not. And after that, you will comment on the ventricles, that ventricles of normal size are dilated. And you will also comment on the parenchyma overall, that whether it is atrophied or normal. The other things that can also be commented on CT scan while looking on CT scan are the bones, although especially bone window is used for the looking fractures, but in the brain window also you can see the bones if any fracture are affected. And sciences can also be seen, but these are things which related to the radiologist. So this was a brief review, that the things that you should not skip while describing CT scan. Thank you for your time.